In this presentation, I will provide an overview of global recommendations and guidelines to support the use of multiple micronutrient supplementation in pregnancy, including the context of COVID-19. Globally, 1 in 10 women are too thin and 1 in 3 women are anemic. And these are two conditions that have largely remained unchanged over the last 2 decades and continue to threaten the survival and well-being of millions of women in low and middle-income countries and are linked to the births of 20 million low birth weight babies annually. Moreover, with evidence-based interventions and supportive policies in place, there are missed opportunities to deliver essential nutrition services to pregnant women. Less than 2/3 of pregnant women are covered with 4 antenatal care contacts, and 1/3 of pregnant women receive the requisite iron and folic acid supplementation doses. The COVID-19 pandemic has exposed these system weaknesses and threatens to undermine country progress in nutrition. Such setbacks in access to quality diets, services, and coverage risk to exacerbate malnutrition among pregnant women and increase low birth weight, wasting, and stunting. UNICEF's latest reporting on the impacts of COVID-19 related service disruption shows that over 1/3 of reporting countries face setbacks in delivering nutrition services for pregnant women in the last quarter, and over 1/3 of these countries also reported a 10% or more drop in coverage. The previous presentation provided a review of the evidence which forms the basis for the updated WHO recommendations on the use of multiple micronutrient supplementation in pregnancy. The implementation of these recommendations offers an important opportunity to improve maternal diets, anemia, and low birth weight, and to revitalize nutrition services and care for women in pregnancy. This recently issued guidance recommends that MMS should be introduced in the context of research. So what does research mean? For countries interested in introducing MMS, this means introducing it as part of implementation research. Such implementation research should aim to proof test strategies to demonstrate equity, feasibility, acceptability, and sustainability of MMS in program settings, and to use this evidence to influence policy change, domestic resource allocation, national scale-up, and inform MMS introduction in other countries. The recommendation also considers the need for additional clinical research to strengthen the evidence base and to inform future recommendations, such as on the use of ultrasounds in early pregnancy to establish gestational age, additional assessments of maternal and perinatal outcomes, and longitudinal follow-up of infants whose mothers were supplemented in pregnancy. For those countries interested in introducing MMS, forthcoming guidance will allow decision makers to assess their readiness. Criteria for considering MMS introduction include where there's a need, where there are poor quality maternal diets, a high prevalence of micronutrient deficiencies, including anemia and high rates of low birth weight, where there's a commitment to introduce MMS as part of antenatal care and to test alternative delivery platforms, where capacities exist to support the transition to MMS, such as training for health and community workers to improve maternal micronutrient coverage and adherence, and where MMS introduction can be integrated into routine monitoring systems to measure who took it and what worked. And there's additional guidance to support country-level MMS introduction also forthcoming, and such guidance is on introducing MMS as part of implementation research, which includes roadmap for planning and additional analysis needed to introduce MMS. This guidance is based on WHO's implementation research recommendations and is based on the experiences in introducing MMS in countries over the last 2 years. Guidance on feasibility of local MMS production and procurement, and formative research, which is currently being tested in countries and forms the basis of presentations in part 2 of this symposia. And finally, guidance on essential nutrition actions needed to protect maternal diets, services, and practices to mitigate the secondary effects of COVID-19. Essential nutrition services for pregnant women include adaptations for continued access to nutrition care, access to markets offering nutritious foods, expanding the use of social protection programs to cover maternal nutrition needs, maintaining uninterrupted supplies of essential nutrition commodities, including the continuous access of these commodities for women, and the use of innovative communication strategies on healthy eating and food hygiene. And then finally, ensuring that there are measures to ensure routine monitoring of these services. Many of these recommendations have been adapted and are being implemented across countries. And as countries move beyond the response phase to recovering from COVID-19, there's also an urgent need to restore and build back systems to deliver essential nutrition services. This is an opportunity to reflect and to consider new interventions such as MMS and the strategies that are urgently needed to deliver these services to women to improve their well-being and that of their infants. I'd like to thank you for your attention and look forward to supporting your efforts to bring MMS to the field.